This will counteract the effects of internally rotated shoulders while sitting, texting, and working long hours at a computer desk job. It rotates your shoulder joint externally to restore shoulder alignment, blood flow to the arms, hands, and brain, and alleviates nerve impingement. It's excellent for rotator cuff tears, thoracic outlet syndrome, frozen shoulder syndrome, cold hands, and neuropathy in the extremities. Here's a warning. This was my least favorite as I was healing my rotator cuff tear. Now it is my favorite for the whole body. The equipment needed? A sturdy wall. The way you place your hands determines whether you will get the full value of this stretch for your entire arm and shoulder. Begin in the please don't shoot position with your hands directly in front of your shoulders. Place them on the wall, shoulders width and shoulder height apart. Make sure your thumbs are pointing toward each other, but keep the middle fingers pointing straight up toward the ceiling. Squeeze your elbows as if you're trying to hold a watermelon between them. Make sure your hands are not too high, aren't twisting outward, or don't cup up. Step back and bring your head down between your elbows, making sure the crease of your elbow or your elbow pits are facing the ceiling. Untuck your tailbone. You're working toward having the small of your back lower than your sacrum. You'll feel this in your shoulder girdle and hamstrings. Keep your legs straight. Remember that when your feet are straight and you externally rotate your upper legs, the tendons on the back of your legs won't allow your knees to hyperextend. Align your hips directly over your ankles. Check out your toes. If they're gripping, back your weight into your heels and let your toes relax. Now allow your awareness to come into your abdomen and imagine your belly button coming closer to your spine. Hang your head. But if your elbows bow out, don't sacrifice elbow pits bowing out for head down. Bring your head back up if this happens until you can ensure that your elbows don't bow out. Now you can bring your attention into letting your chest sink toward the floor, letting the shoulder blades slide toward your bottom. As you look at your feet, make sure you maintain a hips width distance. Ask your kneecaps to drop so you're not gripping in your thighs. Lifting and lowering them can bring a lovely feeling of isometric stretch in your hamstrings. Maintain a distance of shoulder's width between your hands, and periodically remind yourself to back your weight into your heels, untuck your tailbone, relax the tight grip of your sphincters, and to externally rotate your upper legs. By about 40 seconds, you should really begin to feel the overall stretch in nearly every area of your body that has been deprived of oxygen. Circulation's getting into the once tight corners of your body, and your fascial holding patterns are being interrupted as you are reminded that you don't have to be in fight or flight mode all the time. If your arms start to shake, overemphasize it throughout your body. You can interrupt and calm the panic by allowing your body to wiggle and shake. Your body needs this little tantrum to let go of its perpetual on-guard grip. Here are some common mistakes and symptoms they create. Lifting your head, bowing your elbows, cupping your hands, rounding your back, tucking your tailbone, bending your knees, turning your feet out. These mistakes will reinforce malalignment and cause you to miss out on the full value of this stretch. Stay in the stretch longer than 40 seconds to get the fascial release benefit. Do this stretch often, 3 times a day or more. Your body will crave it, and it will let you know when it's time to do it again if you begin to experience any of the symptoms just listed.